Welcome to today's deep dive. We are looking at some really fascinating clinical excerpts detailing um, metabolic syndrome.
Yeah, which is a term that sounds incredibly intimidating when you first hear it.
Right. It sounds like heavy medical jargon.
Hmm.
But our mission today is to translate that into a really highly accessible, empathetic guide for, your everyday health. We want to focus on prevention and early warning signs.
Exactly, because it's actually incredibly common.
So you know that sinking feeling when a red warning light pops up on your car's dashboard?
Oh, yeah, like the check engine light. You just hope it goes away.
Right, exactly. Having one tire slightly low on air might not stop the car, and you figure you can push it off. But what if your engine temperature, your battery, and your oil lights all glow red at the exact same time?
You're definitely not just looking at a quirk anymore.
No, you are looking at a systemic breakdown.
Yeah.
And in the human body, that breakdown is called metabolic syndrome.
That is honestly a perfect analogy
Yeah.
because metabolic syndrome isn't actually a single disease.
Right, it's a cluster.
Yeah, it's a cluster of 5 specific warning signs. And just like that dashboard, if 3 or more of these lights are flashing at once, you are heading for a major breakdown.
Like cardiovascular disease or type 2 diabetes.
Exactly. A massive increase in your risk for both of those.
Let's look at what those 5 warning lights actually are so you know what to look for. We're talking about a large waistline, high blood pressure, elevated fasting blood sugar, high triglycerides, and low HDL cholesterol.
Right. And, having your blood pressure spike just a little on a stressful day is one thing.
Sure.
But when it's elevated alongside a large waistline and high blood sugar, those factors multiply each other's danger.
So what's the thread connecting them? Like, why do these 5 specific things always seem to crash the party together?
Well, the unifying link under the hood is insulin resistance. And that's driven by something called visceral fat.
Wait, meaning the fat stored deep inside the belly, right?
Sure.
Not the soft fat just under the skin.
Exactly. And here is where we get into why it's so dangerous. Visceral fat isn't just inert storage.
It's not just a spare tire sitting in the trunk.
No, it actually acts like a rogue organ. It pumps out fatty acids and inflammatory chemicals directly into your system.
Oh, wow.
Yeah, and that basically blinds your body to its own insulin.
Okay, so if insulin is the key that unlocks our cells to let blood sugar in for energy, you're saying this visceral fat basically gums up the lock.
That is exactly what happens. The sugar gets locked out of the cells, it builds up in the blood, and your body responds by pumping out even more insulin in an absolute panic.
Wow, so that cascading failure triggers the high blood pressure, messes with your cholesterol, and eventually damages your blood vessels.
Yep, it completely throws the system out of balance.
But hold on, I know plenty of people who are a normal weight but still have high blood pressure or blood sugar. Do you actually have to be overweight to get this?
You absolutely do not. Normal weight people can totally have metabolic syndrome.
Wait, really? Like a totally average weight on the scale?
Right. Yes. Our sources highlight that it's highly prevalent in certain populations, like in South Asia or Central America, where genetic factors influence fat distribution.
Ah, I see.
Yeah, because it's about where the fat is stored internally, not just the number on the scale. You can look entirely typical, but still have that visceral fat interfering with your internal organs.
Okay, so if this syndrome has basically zero outward symptoms, I mean, you can't just feel your insulin resistance or your triglycerides going up, you're probably wondering how you're supposed to know if you're currently in danger.
Well, the only way to peek under the hood is to get routine lab work.
Seeing a doctor for regular checks?
Yeah, checking your blood pressure, sugar, and cholesterol levels is non-negotiable. That is the only accurate way to read your internal dashboard.
But here is the incredibly hopeful news from the sources. If those lights are flashing, you don't need extreme, miserable measures to fix it.
Not at all. Losing just 5% of your body weight massively improves how your body handles insulin.
Just 5%.
Yeah, because visceral fat is highly active, it's often the first fat your body burns when you go into a calorie deficit. It clears out of the liver and organs surprisingly fast.
And you don't need to suddenly run marathons to make that happen. The sources specify that just 30 minutes of moderate daily activity is enough.
Right. We're talking routine things like brisk walking, gardening, or even rigorous house cleaning.
It's simply about giving that trapped energy a place to go, right?
Exactly. When you move your muscles, they pull sugar right out of the blood. It's the best way to counter this highly sedentary environment we live in.
Which actually leads to a provocative thought I want to leave you with today.
Oh, what's that?
Well, if our modern industrial chair-bound lifestyle is the main engine driving metabolic syndrome, how might your specific daily environment and tech habits be secretly reshaping your internal metabolism without you even noticing?
That is a fascinating question.
Right. Are your screens keeping you in the driver's seat of a parked car while the engine runs hot?
Definitely something to seriously ponder as you look at your daily routine.
Absolutely. Keep an eye on those dashboard lights. And as a clear, friendly reminder, this deep dive is strictly for educational purposes and should not be taken as professional medical advice.
Always consult your doctor for your health needs.